Hello Bio 245 kids, I'm here to record for you some of the bones so that way you guys can be prepared for the practical in the event that we have to close campus because of snow and all that fun stuff. So I'm basically just going to go in the order of the list. You guys should all have your list, of course. I'm going to start with the skull with frontal bone here, so I'm going to kind of skip over this more definitional stuff at the top because I'm sure you guys can look that up yourself. If you have questions, you can ask your TA, or you can ask me, or you can ask Austin. So I'm going to be using this colored skull to demonstrate, and hopefully my camera angle is not too weird so you can actually see when I'm trying to show you stuff. So first things first, we have our color-coded skull, which I will try to put the lid on more securely. Okay, first things first, we have our skull here, and if you remember the frontal area of the body, this is going to be the frontal bone, so the forehead, in this case the green bone shown. On your list just below that, you'll notice that there's the term frontal sinus. A sinus is a hollow area in the bone, so the bone's not completely compact material, there's also holes inside. So if you look at this guy, for example, so here's his eyeball and his nose and all that stuff, just to orient you. Here's his frontal bone as you would expect, and you can see that there's a hollow space inside. You can also see this on the sagittal cuts. Here's one of my sagittal guys just to show you, so you can see here's his nose, lips, chin, just for reference, and there's the hole inside of the frontal bone, so frontal bone is going to be the forehead area. There you go. Next on our list is parietal bone. Parietal bone is going to be the top two bones, so here's our front. There you go, along the dorsal side of the skull, the dark yellow and the light yellow. So yes, there are two parietal bones and they are identical. Next is temporal. So temporal, you notice on your list, has quite a few structures. Temporal, in the first place on this skull, you'll see is this purple bone, which kind of makes sense as that it's called temporal because this is kind of the temple area of your head, and this is where your ear hole is, just to give you some reference here. So going down the list, again, we have the zygomatic bone, and we have something called the zygomatic process. So if I hold the skull like this, you can see that this part here is still purple, and there's this process. A process is anything jutting out of a bone that's connecting over here to this blue bone. This blue bone is going to be the zygomatic bone, so wherever this is connecting to, in this case the zygomatic bone, it's called the zygomatic process, in this case of the temporal bone. Moving on, we have the styloid process, so this might be a little hard for you guys to see, but I'm turning the skull upside down. So again, here's that zygomatic process, and you can see that there's like this peg sticking out of the purple bone here. So this is the styloid process. It comes from the word stylus for pen, and you can see there's your ear hole, so it's just right above your ear hole there, and here you can see it's just this little thing sticking out. Next, we have the external auditory or acoustic meatus. The external acoustic or auditory meatus is your ear hole. Easy peasy, right? So right behind your zygomatic process. And in fact, if you feel back along your cheekbone, you'll see it does eventually lead into your ear hole, that being your acoustic or auditory meatus. Next is the mastoid process. So this one you can feel on your own skull as well, but here's our guy. There's your zygomatic process. There's your external acoustic auditory or acoustic meatus. There's your styloid process. Here's this lump right here, and you can kind of see from like that as well. That's going to be your mastoid process. You can feel it on your own self. So again, behind your ear, right, there's a lump. You've seen probably some girls get tattoos here, but anyway, that's going to be your mastoid process. Moving on to the jugular foramen. The jugular foramen is a little bit hard to see, so I'm going to be kind of poking at it with a probe here. But it actually is kind of at the junction. So here's our temporal bone, all purple. There's this other bone back here, which we're going to get to. But the jugular foramen, in fact, I'm going to take this off. I know I struggled to get it on in the first place. But it's kind of at the junction here between the purple and the rusty colored bone. But actually here you can see my eyeball through it, and here I'm poking the probe through it. This here is going to be your jugular foramen. You've probably heard the word jugular before. The jugular is referring to a large vein that takes blood back from your brain to your heart. This is a very useful hole to have as a result. But yeah, so there's your jugular foramen, and just to kind of give you an area here, so there's your styloid process, and there's your jugular foramen right next to it. Moving on, we have the carotid canal. Carotid canal is equally important to our jugular foramen. It allows the passage of the carotid artery. So again, really important holes. So just to orient you once more, there's your jugular foramen. There's your styloid process sticking out there. The carotid canal kind of forms a little triangle with those two other structures. So tilt it so you can see there's your jugular foramen. Next to it is this dark kind of cavity. That's going to be your carotid canal, and then next to that is your styloid process. And in my mind, it kind of forms a triangle, so I always look for those. Next is your internal auditory acoustic meatus. So in this case, you're going to look on the inside of your skull now. So here's the front, there's the inside, and of course it's still in your temporal bone, so you're looking at the purple. The internal acoustic meatus allows the passage of the auditory nerve. So this is kind of where all your hearing stuff is, if that kind of makes sense. You got your external acoustic meatus here. There's all the stuff that you need to actually hear. And so coming out, kind of on this posterior side of the ridge, because remember this is posterior, this is anterior. On the posterior side of this ridge is this little hole, so that's going to be your internal acoustic meatus. Again, this allows the passage of the nerve, so you won't find it on the underside of the skull. It's only on the inside. Moving on, we got the occipital bone. So that rust-colored bone I was telling you about, that kind of forms that junction where that jugular foramen is. Just to show you once more, you can see that there's a nice big hole. Anyway, this rusty-colored bone is occipital. That makes sense. If you remember your region, you'll remember the occipital region. So turning this guy around, you can see the occipital region of him. So there's his front, there's his back, there's his occipital region. Therefore, it's his occipital bone. You have two structures that you got to worry about for the occipital bone. One of those being the foramen magnum. So foramen always just means hole. I know I didn't mention that before. Foramen always means hole. So here's your magnum foramen, or vice versa. Whatever order you put it in, that's going to be fine. Underneath that, you're going to have your occipital condyles. So here's the hole once again, and then on either side of that hole, maybe it's easier if I tilt this, not necessarily, but there's a lump right here. So these lumps facet actually into your vertebrae. Actually I do. So the top of your vertebrae has these little cup shapes, and that's where those occipital processes sit right into. Okay, so condyle always just means that it's something round that's faceting into something else. So you can see it's this round surface. So there's your occipital condyles. Next is going to be your sphenoid. Sphenoid's a weird one, and people struggle with this one. So for this model, this is again the inside, so there's your front. This is inside the skull. You can see that there's this bright yellow kind of moth-shaped bone on the inside. This is going to be your sphenoid bone. I also have one that's dissociated. So you can see it does in fact have that moth shape. There you go. This is as if you were to tear the sphenoid bone out of the center of your skull. You'll see you only have a couple of things to worry about here. So first of it is going to be your sella turcica. So sella turcica means Turkish saddle. So if you look inside here in the very middle, there's this ridge of bone. You can kind of see the light hitting the ridge, but here's this ridge, and there's kind of like a little seat down in here. So I would imagine, like, maybe you can see it from the side a little bit here, but you can have like a little dude in there, and he'd have his legs on either side, and he would hold onto this as if it were a handle. But anyway, that's going to be your sella turcica. So normally your pituitary gland from the brain hangs out in that little crevice. So it's a good structure, no? Next is going to be your sphenoid sinus. So again, a sinus is just a hole. So again, those sinuses are just going to be empty hollow. So here's your frontal sinus, here's your sphenoid sinus. Sphenoid sinus right here. You can see there's the cup shape of the sella turcica, and there's a pituitary gland from the brain sitting right inside of that. Moving on, we've got the ethmoid. So the ethmoid's a little bit harder to see, and in fact, probably the best place to point it out is on the colored skull. But if you look, so again, here's the front. If you look down deep inside of the frontal bone, there's this area that's pure red. I don't know how well you can see if it's red. But this is going to be your ethmoid bone here, and you can see that there's this lighter colored ridge in the center. That lighter colored ridge is going to be called your crista galli. So crista galli, okay? On either side of that ridge, so there's where it's like dark and red on either side of that ridge, that's going to be the cribiform, okay? The way I always remember this is we have crista galli in the middle, so, and then it's sitting in the cribiform. So I always think Christ in the crib. And if you really want to get fancy about it, since it's crista galli, you can say Christ from Galilee. He was, in a crib. There you go. Maybe that'll help, maybe not. I also have the ethmoid bone dissociated here, so you can see this. I think this is going to be, yeah, I think this is the anterior side of it. But here you can see there's that little ridge sticking up, and then on either side is going to be your cribiform. So crista galli, cribiform, Christ in the crib, blah blah. Next is the different kinds of nasal concha. Now the nasal concha are difficult to see. You can usually see them in the sagittal cut head, so this guy here. You can also see them kind of if you look into the nasal cavity. So you can see, looking into the nasal cavity, there's like this little piece of bone that kind of sticks out here. And there's another, I don't know how well you can see, but there's another piece of bone sticking out of the side wall there as well. You can kind of see that. Anyway, those are considered to be nasal concha. Probably the best place to indicate this would be on the sagittal, so I'll show you on there. So here's our nasal concha here. So again, it's on that more lateral wall of the inside of the nasal cavity. And you have the inferior nasal concha, the middle nasal concha, and the superior nasal concha. So they're just named after where they're located relative to each other. No big deal though. Sorry for that loud, horrible noise. Next we have the ethmoid sinus. So the ethmoid sinus is weird. A lot of people think you can see it on this sagittal cut. But if you look at your ethmoid bone, so there you go, there's our ethmoid bone, you can kind of see that it has these like two big lobes on the side. So if you cut it down the middle, do it sagittally, you won't really get a sinus. It's just a piece of solid bone. The only way you're going to get a sinus is if you cut it this way, so transverse, okay? So you need a transverse cut to see the ethmoid sinus. So here you go. Here's our guy. He has this transverse cut across the ethmoid bone, and you can see all these holes in here. I feel weird leaning in. All these holes right here, that's going to be your ethmoid sinus, okay? So frontal sinus at the front. There's a sphenoid sinus all the way back here. There's that little pocket back there, and then the ethmoid sinus is the rest of this stuff. Moving on, we got a couple more bones to cover. You can see we have the mandible. This is a real mandible. We got a mandible here. That's just your lower jaw that holds your lower teeth. Some of these bones I like to define just by the fact that they're holding certain kinds of teeth. Makes it a little bit easier. Next we have the zygomatic, which I mentioned briefly, because remember we had that temporal bone with the zygomatic process. The zygomatic process, like I said, is coming off of the zygomatic bone itself. The reason why it's not just called the zygomatic bone is there's actually, you can't see it on this because it's just divided by color, but there's a suture here that divide the two bones. So we know that these are different bones. So this process is just named after the bone it's connected to. So this is the zygomatic. And again, zygomatic, and you can follow that arch all the way back. Next is the vomer. The vomer is a weird one. If you look in the back here, so here's this front, again, just to orient you, there's this kind of a very, very mid-sagittal plate in the middle there. You can't see very well. Oh, no, yeah, there you can. It's a bright orange bone. That's going to be your vomer, separating either the right and left halves of the nasal cavity from each other. Next is the maxilla. The maxilla on this particular skull is this kind of rusty pinkish kind of color. And remember how I said it's sometimes easier to define a bone by like the kinds of teeth that it's holding. So if you turn this over, it's still that rusty kind of pinkish color, and it's holding all of the upper teeth. So whether I put a sticker here or I put a sticker here, I'm still asking for the maxilla bone. Going back from the maxilla bone, I'm going a little bit out of order, but this might make it a little bit easier for you guys. So there's your maxilla, and then heading back, so back that way, right? You can see there's this gray part right here. That's going to be the palatine bone. For any of you who are singers or speakers or what have you, you might be familiar with this hard and soft palate. You know, you lift your soft palate to sing, etc., etc. So the palatine bone kind of forms the junction between the hard palate and the soft palate, which is a fleshy piece of flesh right there. Next is going to be the lacrimal bone. So the lacrimal bone, you guys might recall when we learned about the lacuna and the osteon, the lac, L-A-C, means lake. So if the lacrimal bone in this case is this dark green bone kind of on the inside of the eye, the lacrimal bone actually covers the lacrimal duct, which collects tears. So if you think about lac, L-A-C, meaning lake, it collects a little lake of tears. And I always tell my students it's a lake of sadness because it's collecting all your tears, and you can even see that there's a hole in there. Sometimes it's a little hard to distinguish on the light colored skulls because they're just white, but you'll always see that little hole there that is the opening for the lacrimal duct hidden behind the lacrimal bone. Next is nasal. So there's our front of our skull again. So on the top there, on the bridge of your nose where your glasses sit, that's your nasal bone. Easy peasy, right? And then next is going to be your hyoid. So the hyoid bone is actually at the top of your pharynx. So your pharynx, here's our half head model to display this for you. But, you know, there's your oral cavity, nasal cavity, all that kind of stuff funnels down in here. Your larynx is here. And at the top of it is going to be your hyoid bone. So the hyoid bone is this little guy here. He looks kind of like a horseshoe shape, and if you set him down, he has these little vampire teeth that stick up. So he sits about there. And if you look at some of our skeleton models, you'll see that they have a hyoid bone sticking out of the front too. This is the only place where the tongue originates and attaches. So helps facilitate speech. It's kind of cool. Okay, so we're done with the skull. Let's move on to the vertebrae. So there's 3 different kinds of vertebrae, and you got to be able to know the numbers of them and how to identify them if I just put them on a table. But also you should be able to know the regions on the actual skeleton where you can find them. So firstly, you'll see on your list that we have the cervical vertebrae. So cervical vertebrae, oh, let me just show you all 3 so you can actually kind of see the differences here. So here's a certain kind of vertebrae. Here's another kind. Here's another kind. Okay, so you'll notice that these all have, you know, a pointy bit sticking out of the front, right? There you go. Well, actually back, so the pointy bit points backwards. But there, you see that again. They've all got a hole. This allows the passage of the spinal cord. And they've all got like this kind of body section, okay? The body section is where they all kind of rest against each other. And you can see this, no, you can see it mainly on the skeleton. I think you guys understand how vertebrae work. So firstly, we've got the cervical vertebrae. So if you look at the cervical vertebrae down, you'll see that it's got the big hole for the spinal cord, but it's got these additional little holes to the side. So these little holes here accommodate your vertebral artery. You won't find this in any other vertebrae. You're only going to find this in the cervical because this vertebral artery only goes up the sides of the neck. And actually, I do kind of have a cool model for this. Here you go. So this is a cervical vertebrae stack. You can see, like, here's where the bodies of the vertebrae would be. There's a little spinous processes pointing out towards the back. And you don't gotta know body and you don't gotta know spinous process. You just need to know about the vertebrae and how to identify them and how many there are, blah, blah, blah. Okay? Anyway, you can see here's that spinal cord going down through the hole, and then from the side here you can see this red tube passing down those little holes for the vertebral artery. Okay. So next we have the thoracic, oh sorry, and I forgot to mention, there's 7 of these guys, 7 total, and that includes the 2 weirdos at the top of your cervical vertebrae. You don't need to know about them, but it's the atlas and the axis. You don't gotta know how to identify them or anything. So there's 7. Next, we've got our thoracic vertebrae. So the way that we usually introduce these is their faces on the dorsal side. They kind of look like critters. In this case, it looks like we got a giraffe. There's his little antler nubbins in his ears, in his nose. So this guy we call Timmy the giraffe. T for Timmy thoracic. Okay, so this is going to be thoracic. And as you might imagine, it's going to be the thoracic region, right? So here's our lovely assistant. Again, here's our cervical vertebrae. Cervical, if you remember the region, is going to be the neck. The thoracic region is going to be where all these ribs are kind of attaching to. So there's your thoracic. There's 12 thoracic vertebrae. And again, if you look, looks like Timmy the giraffe. And also if you look from the top, you'll see that the body of the vertebrae and the hole there, that foramen, they're similarly sized. This is important for the next guy. Next we have the lumbar vertebrae. If you look at him dead on, he kind of looks like a moose. So, you know, there's got like his cheeks and his nose and then his antlers up top here. So there's our moose. We call him Larry the Moose, Larry L. lumbar. If you look from the top, you'll notice that the body is significantly larger than the foramen here. This is for a couple different reasons. The spinal cord tapers as it goes down because it's threading off all those nerves throughout the body as it goes. But also you have more gravity pressing on you the lower in your body, so you get a large body for the vertebrae. It's kind of hard to see, but yeah, you can kind of see. So here's our lumbar vertebrae. And if you recall the lumbar region, it's just the lower back. And again, there's 5 of those. So one way that people can remember the numbers, breakfast, lunch, dinner. So cervical 7, thoracic 12, lumbar 5. So breakfast is at 7 a.m., lunch is at 12 p.m., and then dinner is at 5 p.m., depending on who you are. And I know some people still struggle with cervical, so you can always think like, I have cereal for breakfast at 7 a.m., so cervical, there's 7 of them at the top. Next is going to be some of the bones in the coxal region. So coxal region is like all these bones and whatnot. But anyway, so this is the front of your pelvis. So as you can see, this is the back of your pelvis, and you can see there's a couple of lumbar vertebrae there stacked. And you can see that there's this big bone right here between the two halves of the pelvis, and it's kind of like almost like an arrowhead kind of shape, and it's got these holes in their side here. So this is the sacrum. You guys are probably familiar with the sacral region right there, right between the two halves of your pelvis, and you can feel it if you press on your own self. And then coming off the bottom there is your little tailbone. This is going to be the coccyx. So if you break that, I've heard of some people breaking that. Apparently it's very painful, but you know, you'll live. But yeah, so that's the base of your vertebrae. Okay, moving on, we are going to talk about the sternum. Let's just move along. So you'll probably remember the sternal region being the center of the chest, right, of the thoracic region. So here at the top, we have this kind of pentagonal or hexagonal shape. This is going to be the manubrium of the sternum. So right in here, between your collarbones. Going down, we have the body of the sternum. Easy peasy, right? At the bottom of your sternum here, there's this little notch, a little triangular notch. There you can see the contrast against my hand. This little triangular notch has a big name. In this case, it's the xiphoid process, and it's spelled weird, so Xiphoid, xiphoid process. Xiphoid process is a little weird. I'm sure it forms some kind of important attachments for muscles, but the way I always remember this one is when I was in high school, we learned about CPR, and when you do chest compressions, you have to be very wary of the xiphoid process, because if you push too hard, you can actually puncture the spleen, which is right back about here. I don't know how that even works, but apparently you can puncture the spleen, so you have to be very careful about doing your chest compressions, because if you do puncture the spleen, it leaks all kinds of nasty toxic stuff, and your patient will be dead in 10 minutes. That's not pleasant, so, you know, avoid puncturing your spleen with the xiphoid process. I don't know if that helps anyone. I hope it does. Moving on, we got ribs. So you'll notice next on your list, if you look at the ribs, it kind of gives you a count. It says 24 total ribs, and then it's weird because it says true 14, false 10, and floating 4. So true ribs, all that means is that it goes from the vertebrae and connects directly via this hyaline cartilage to the sternum. Okay, so that's a true rib. And then next is a true rib, next is a true rib. When it's a false rib, it either attaches via like one cartilage piece and it shares it with a couple other ribs, or it doesn't attach to the sternum at all. So the floating rib is considered a part of the false rib category, so altogether that's 10. So here you can see kind of at the bottom here, there we go. So we got this rib and this rib and this rib, and they all come together and share a piece of cartilage. So you can see that there's 3 there. And then if you turn our guy here, here's a rib and here's a rib that don't even attach to the sternum. So those are our floating ribs. So 3 on each side of our false ribs, right? And then 2 on each side of those floating ribs. So 5 plus 5 is 10. So yeah, so 14 true ribs, 10 total false ribs, only 4 floating ribs. So but altogether we have 24 ribs. Hopefully that makes some sense. Next, we've got our clavicle. I know I had one here just a second ago. Here we go. Okay. So the clavicle is going to be your collarbone. Here's our lovely assistant to kind of show us that. So there's your clavicle and where it is on the body. If you look at the clavicle, ignore this. If you look at the clavicle, it kind of has this nice S shape. So if I throw this out on the table for practical, you should easily recognize this nice S shape there. Okay, so there is your clavicle. Next is going to be your scapula. So your scapula, so here's our clavicle on our model. If you turn them around, you see it attaches to our shoulder blade or the scapula, okay? So you guys should recall the scapular region from when we learned about regions. And again, the way I explained it was it's just your shoulder blade area. So here you can imagine there's your clavicle, there's your shoulder blade, blah, blah, blah. So there's a part of your shoulder blade that faces inside, faces your rib cage, and there's a part that faces out. So in this particular case, if you look at scapula, there's a couple different terms to know. So the side facing out, right? So facing like you can feel that ridge on your own shoulder if you feel. But this part right here is called the spinous process of the scapula. So it kind of makes sense, right? What do they call it? Oh, the scapular spine is another way you can refer to it. But this is the spine of your scapula, okay? And then it says supraspinous fossa. So fossa just means like a hollow or just like a flat kind of space. So in this case, you can follow the terminology, right? Supra, meaning superior, spinous, talking about the spine here, and then fossa, meaning some kind of space or hollow. So in this case, here's our spine, our scapular spine, superior to it is up here, and then here's our fossa. So that's your supraspinous fossa. Same with the infraspinous fossa. So there's your spine, inferior to it, this whole thing is the fossa. So that's your infraspinous fossa. Flip it around, you have the subscapular fossa. So sub, always meaning kind of deep, right? I don't think that goes in any of our terminology, but you can think about like subways and stuff, they're always underneath the ground. So in this case, it's on the deeper side facing the actual rib cage, so underneath. Anyway, that's your subscapular, because this whole thing is a scapula, fossa, this flat space. Moving on to the limbs. I hope you enjoyed that axial run through. Moving on to the limbs. So first we have the humerus. The humerus, oh, we have a humerus on this guy still. Most of these guys are really taken apart. Anyway, so the humerus is going to be the bone of your brachial region. There's a couple distinguishing features if I throw it on a table and ask you to identify it. So here you can see it's got this rounded bit, that's where it's going to fit into your shoulder joint. And at the bottom, it has this, I don't know how to describe it, but it's a very interesting facet here where the ulna facets into, and we'll talk about the ulna in a second. But there's your humerus, okay? Moving on, we have the radius. The radius is kind of an interesting bone, and I don't have one just by itself here at this moment. But for the radius, so here's the bones of the lower like forearm. So let's see here. This is going to be pinky side, so it's kind of like this. Anyway, so here's this guy here, and here's this guy here. Now, if you look at the tops, they look pretty different. This guy here kind of has like a suction cup shape, and he has this kind of triangular, broad bottom. Okay. So this is the radius. It has this broad, it almost looks like a tooth at the end, and it's very broad. And then the other side has the suction cup. So that's what I would look for, is that suction cup. It's the radius because you can kind of see, I don't know how well you can see it on this camera, but it actually like rotates against the other bone it's sitting against. So that's why it's called the radius, because it rotates around its axis. Next we have the ulna. So the ulna is really cool and really easy to identify. One thing you can always look for, so here's our radius friend again, don't get him confused. But one thing you can look for is this U on the side. U for ulna, right? So there you go. And it tapers down into this smaller triangular shape. You can see that they both kind of look like teeth, but this one's more narrow and this one's more broad. But I just look for that U shape. That to me is super distinctive and you can't mistake it. So that's your arm. Moving on to, oh sorry, and then the ulnar is going to be your pinky side. Radial is going to be on your thumb side, and those are both in your antebrachial region. Moving on, they have us go to the carpals. So if you guys remember, the carpal region is your wrist, right? So carpal tunnel syndrome, you've got issues in your wrist. Everybody knows that. So these guys are a little bit, I'm going to drag this a little closer and kind of get close to you guys. Maybe be a little creepy, I'm sorry. But, so here's your thumb. Here's your pinky, just to orient you. So this is your radius side, and this is the posterior side of your hand. Remember, your palm is anterior, the back of your hand is posterior. So if you look at your carpals, they kind of all look very similar. They're difficult to tell apart, and they all have crazy names, but there's a cool little mnemonic. I suck at mnemonics, but I'll tell you guys the mnemonic, and hopefully that'll help somebody. Anyway, you start at this guy that's shaped like a cashew, okay? So that's where you start. The mnemonic goes like this, or at least the most popular one I know of. Some lovers try, and then you kind of switch around just a little bit. There's this bone that hangs off on the anterior side. Positions. Then you go back to the thumb again. And then you start again. Try positions that they can't handle. So some lovers try positions that they can't handle. Okay, so that's the mnemonic. For me, I gotta look at the shape and I gotta know where it is, and that's the only way I know how to identify carpals. So I'm gonna tell you guys just a couple little things. First of all, we have that little cashew shape guy I was telling you about before. This is the scaphoid. The scaphoid, again, is shaped like a cashew. That's the main way I identify it. And to me, it kind of forms a scaffold here between the hand and the antebrachial region, right? So here's our radius, and the scaphoid kind of goes along it. So to me, it's like a scaffold. Anyway, moving on. Next up, we have the lunate. The lunate, if you were able to twist it, I don't know if you really can, but if you're able to kind of twist it, if you look at it from the side view, it looks like a crescent shape, like the moon, right? So lunar, lunate, there you go. Oh, there's a number on it. Dang, it burns. Next to that is, so again, scaphoid, lunate. Next to that is, you can't see it super well in here, but this is the triquetral. So the triquetral is kind of triangular, as you might imagine, and it abuts next to 3 bones. In this case, this little guy that I was telling you about before, this nubbin that sticks out, and this guy, and this guy. So it abuts next to 3 bones, so triquetral. Also, if you know the mnemonic, then you can go, you know, some lovers try triquetral. Easy peasy. Next, so this is still our posterior side. Next, twisting it around, there's that nubbin. This is the pisiform, or the pisiform, or the pisiform, or however you want to pronounce it in your life. That helps you remember to spell it. Pi comes from the word pea, as in the legume, like green peas and carrots. So there you go, there's your pisiform. Going back around, I guess, we can go back around. Actually, no, let's not go back around. Let's kind of go down and then come back across back to the thumb. So there's our triquetral, there's our pisiform. Here's this big bone here, and you'll notice that it's attached to this bone that's attached to the pinky, okay? And this bone's fairly large, pinkies are pretty small. And so when I was in high school learning this stuff, I always told myself that the pinky is hamming it up, it's a little guy, and he's hamming it up on this big old carpal here, the hamate. That's lame, you may or may not remember that. Probably the best way to remember it is if you turn it around to the anterior side, so there's your pisiform sticking out, you'll notice that there's this hook shape sticking out of the hamate, okay? There you go, little hook. This is called, sorry, it's not called anything. You already know the name of the hamate. Hamate comes from the word hamis, which is Greek for hook. So it's literally this little hook sticking out. There's your hamate. Next to the hamate is the capitate. The capitate is actually the largest carpal in your hand. Capitate coming from the word head. The capitate here, the way I remember it is it's attached to this bone here, which is attached to the middle finger. And if you're an angry person in traffic, you may be threatening to decapitate people while you're flipping them off and all kinds of bad stuff that you shouldn't do. It's very naughty. But anyway, capitate. Yay. And it also kind of, I guess, is shaped kind of like a head more so than anything else, so I don't know, whatever. Anyway, moving on. The next two are kind of weird because they're both trap, so people get them confused. But here's the trapezoid. Some people say it looks like a trapezoid. I don't see it. Maybe I'm just lame and I don't see it very well and I don't have much of an imagination. And then there's this guy here. This is the trapezius. So the trapezius and then the trapezoid. So the way I remember to distinguish them, because as long as you remember one, you remember the other, right? So the trapezius here is attached to this bone, which is attached to the thumb. And you know, like when you flex your hand, these bones don't move very much, right, in your palm area. But the one attached to your thumb moves quite freely. So I always say it's as if it's on a trapeze. So the trapezium and then your thumb metacarpal, or this bone right here, it's like it's on a trapeze. So then you know the one next to it is trapezoid. Excuse me. So there you go. Scaphoid, lunate, triquetral, pisiform or pisiform or what have you. Trapezium, trapezoid, capitate, hamate. Okay. And you've heard me refer to these a couple times. These are your metacarpals. These are your phalanges, or your, what do they call it on here? Yeah, phalanges. So there you go. Their fingers are called your phalanges. You don't gotta know 1, 2, 3, 4, 5, blah, blah, blah. You just need to know this is a metacarpal, and this is a phalange. Easy peasy. Okay, next is the pelvic bones. So just to kind of, well, let me shove this back so I'm not creepy anymore. Okay. So again, pelvic bone, here's the front, here's your back, right? There's your butt. Basically, that's what you sit on, okay? And just to orient you to kind of what I'm looking at, here you go. This is the half of a pelvis bone. You can kind of see what I'm talking about. Okay. So the reason why I point that out is because the way that you orient these, again, this is your front, this is your butt where you sit. This is the pubic bone, which makes sense if you think about the pubic region, so pubic bone. You sit for your butt on your ischium. So this is your ischium. And then this here, this big wing, the pelvic crest, this is your ilium up here. So pubic bone, ischium, ilium. Okay? Next is your leg bones. I know that was super exciting. Next for your leg bones, here's from your femoral region, the femur. So this is more I can't think of the word. But this is kind of what people think of when they think of bones. They have that big, like, lobed end, kind of like the Flintstones or something. But the femur on the other side has this big ball structure. This is what facets ultimately into your hip joint, right? It's a ball joint. And so yeah, so it's super distinctive. You're not going to mistake it, for example, with the humerus, which it doesn't have that long neck between the ball-like structure and the bone. And of course the humerus just has that funky looking end to it, versus the femur, which has just the typical bone-like end that you think of when you think of bones in the first place. But again, femur, femoral, that's your thigh, right? Moving on. I want to show you guys how these fit together, and then I'm going to show you them individually. So next is the bones of your lower leg. So you have kind of a big bone here and a skinny bone here. The skinny bone is on the more lateral portion of your lower leg, the fibular region. Surprise, surprise. So here's your fibula, and then there's your tibia. And you can see it's a nice long bone there. You can see that there's like this nubbin here. That's kind of where there's a tendon that straps across the patella. Oh, I don't have an example of the patella. Sorry, patella is your kneecap, by the way. But there's a tendon that stretches across and attaches here, so that's why there's a nubbin. But anyway, so yeah, there it is, and it's got this little tooth that kind of comes down. Whereas the fibula, there's nothing super distinctive about it. It also kind of has this little, let me show you the individual. Here you go. It also has kind of like this little tooth guy on the bottom. That's going to be that bone that sticks out on the lateral side of your ankle. This guy right here, okay? But you can see there's nothing too distinctive. It's super long and super skinny. You're gonna know it's not your ulna or your radius because you just hold it up to your arm and it's ridiculously long. Unless I guess you're really tall, maybe then you might be confused. But you can see it's super long from my elbow, almost to the tips of my fingers. And also, again, you wouldn't confuse your tibia or anything with your humerus, because if you look, it's got this cup shape at the top. That's ultimately where your femur sits in, oh so happily. Okay, and yeah, so you shouldn't mistake it. Also, it's just huge. Like, again, hold it up to your arm. You'll see it doesn't work. Moving on to the ankle bones. These are going to be called your tarsals. So if you're familiar with your tarsal region, which you should be, the tarsals are the bones in your ankle. And again, you got to know all the names of these. There is also a mnemonic that goes with this. Usually, you're only going to be looking at from the top down, so you don't have like that posterior anterior confusion. Where the heck did I put my probie? Here it is. Okay, so there's your tarsals, like I said. Oh shoots, what I really want is a foot. A foot all by itself. There's your tarsals, okay? All beautiful. And this is how your foot sits, so this is your heel bone that I'm pinching. So the heel bone is referred to as your calcaneus. So you might remember when we learned about the regions, the calcaneal region, heel. Sitting on top of that bone, so this whole thing here is your calcaneus bone. Sitting on top of it and kind of wrapping over it is this bone called the talus. So I always think like bird talons, like curling over the top of the calcaneus bone. That helps me. I don't know if that helps you. Moving on down, so again, here's your calcaneus, here's your talus, that's where your tibia sits on top of. Cool. They're attached kind of like, so again, here's your talus, this long bone going across, this is called your navicular. Okay, so navy, N-A-V-I-cular, navicular. And on those, these are your cuneiforms. They're all called cuneiforms, and there's medial, intermediate, and lateral. So the way I remember this is I always think Navy captain, and then cuneiform is a type of writing. Hopefully you guys are familiar with this. Cuneiform is a type of writing that is like super ancient and stuff. So anyway, I always think to myself, the Navy captain writes in cuneiform. 1, 2, 3. Okay? And as long as you remember that the big toe is medial and the pinky toe is lateral, then life is good. So there you go. And then there's this big bone there. So there's your calcaneus again, right? There's this big bone, there's your talus, there's your navicular, and your cuneiforms. This here is the cuboid. It's called the cuboid because it's about as thick and tall as it is deep. Or, sorry, wide. But, that's your cuboid. So the mnemonic for this is crazy Ted Nugent captured innocent little mammals. Or cuddled. I mean, you know, it depends on how generous you're feeling at the time. But yeah, crazy Ted Nugent, probably none of you who know who Ted Nugent is unless you're my age, captured little innocent mammals, lateral, intermediate, medial. Okay? This is a lot, but we're almost done. Oh my goodness. Next is your metatarsals. Again, kind of like metacarpals, right? And then your phalanges, no surprise. Okay, and then there's just the type of joints, so I'll just talk about those right quick. So it says fibrous joint. So a fibrous joint is like, for example, the joints between the parietal bones along your skull. This is considered fibrous. It's inflexible. Kind of like when we talk about fibrous cartilage, right? Fibrous cartilage doesn't really flex. It doesn't move. So this is going to be a fibrous joint. Doesn't move. I mean, you don't want your skull to flex around, do you? It's not a good day. Next is a cartilaginous joint. A cartilaginous joint has a little bit of flexibility. Our friend fell over, but the best example of a cartilaginous joint is the joint between your ribs and your sternum. So it offers some flexion, and obviously it can expand and contract when you're breathing. That's important. But otherwise, you know, it's not a freely moving joint like your wrist or something. So that's cartilaginous. Lastly is a synovial. Should be called synovial? Yes. A synovial joint. So like your knee joint, for example. Synovial is referring to the fluid inside of the knee. You guys don't need to know that, but it's called a synovial joint. So you can imagine it just has free movement. Okay, I'm really close. Sorry. There. Okay. So yeah, synovial joint is just any joint that allows free movement. So there you go. Next is just body movements, which I'll go through right quick. So first is extension. And this, basically anytime that you're taking an angle and you're making it wider. So I'm extending my arm at the elbow. Be specific about where these movements are happening. So I'm extending my arm at the elbow. Versus, for example, you can also extend your shoulder. So I can extend at the shoulder, like so. That's extension at the shoulder. So just be specific about the joints. Next is flexion. No surprise, it's decreasing the angle. So this is me flexing my guns for you, so that's flexion. And again, be specific about where you are. This is flexion at the elbow, this is flexion at the shoulders. Same with your leg, okay? So whenever you're decreasing that angle, and it's gonna be too awkward for me to try and show you, but whenever you're decreasing that angle, that's flexion. Whenever you're increasing that angle, it's extension. Next is abduction and adduction. So just be aware, abduction and then adduction. Abduction is where you're like, ooh, this is abduction. So raising your arms. So moving your limbs kind of away from the midline, if you want to think about that, because you can do it with your legs too. Maybe I can do this without tripping and dying. I don't know if you can see me back here, but if you lift your leg out like this, that's abduction. Adduction would be the opposite. It'd be bringing it back in towards the midline. So same with your legs. Bringing them in towards the midline is going to be adduction. Some people say it's like adding to your body. So if you have your arms out like this, and then you bring them down in towards your body, it's like adding to your body. Circumduction is weird, but circumduction is going to be basically this. So you can do it at any ball joint. So I'm circumducting my arms. Rotations like your head, right? Rotation. This is also rotation. Because remember that radius has that suction cup shape at the top, so it can rotate against the ulna. Lateral rotation versus medial rotations. This is me rotating laterally. This is me rotating medially. Then there's pronation and supination. So mainly when we're talking about this, we're talking about our hands. But the way that you always remember this, so pronation versus supination. So pronation, okay, let's start over. Supination, you're holding a cup of soup. Pronation, you're pouring it out. So when you're supine, you're on your back with your palms up. When you're prone, you're on your belly with your palms down, right? So supine, soup, pronation, pouring it out. And that covers all the skeleton. So this is kind of a terrible video, but hopefully that was helpful to some of you guys. And obviously the labs will be open to you this weekend, so you can come in and look at bones. So yeah, definitely take advantage of that. And if you have any questions, you can always visit with your lab TA. You can visit with me. My name is Vanessa. My email is on your guys' syllabus. So, or of course you can ask any of your buddies that also were able to go to lab, unlike you poor souls who had to stay home drinking hot cocoa in the snow.